It has been in the 30s and 40s in Florida, and us Floridians are not liking this. If you have Raynaud's, you're probably not going to be liking these temperatures either. Raynaud's is a condition that causes your fingers to turn white or blue and can cause a lot of pain and tingling. I'm Dr. B. I'm from Reed Medical Group, and I wanted to talk to you about this important condition that can be happening when the temperatures go down. So again, have you noticed any fingers or toes turning white or blue, having pain or numbness? You may have Raynaud's phenomenon. So this is a condition of an exaggerated vasoconstriction. So your vessels in your fingers and toes will squeeze and not allow blood flow to go to those digits. When this happens, the lack of blood flow will turn your fingers white, and then the lack of oxygen will start turning your fingers blue. This can be reversible, and once it does reverse, then your fingers will start turning red once the blood flow starts coming back. Now that can cause swelling and actually can be quite painful. This can take about 15 minutes to start happening once the reversal starts happening. Things like cold temperatures and extreme stress can cause this to happen. So a lot of people notice this when they're reaching into a freezer or if they are holding a iced coffee. Again, the temperatures outside can be contributing to this. So if this is happening and you're noticing this, you do want to talk to your primary care provider. There is a reason that you want to talk about this. Can be a benign condition and can be primary, but it also can be related to other connective tissue disorders like lupus or scleroderma. So sometimes this is the first sign of these conditions. So we do want to look into these conditions for you to make sure this is not happening with your Raynaud's. There are ways to fix this, so making sure you're trying to avoid these cold temperatures or temperature changes like reaching into a freezer. You do want to try to stay warm, and actually keeping your core body warm is going to be the most important part of this, since that does affect the digits, fingers, and toes. There are also medications that you can take. So again, we do want to talk about this with your primary care physician. If you don't have one, make sure you come by and see us at Reed Medical Group.